Joy 99.7 FM. Joy 99.7 FM.
All right, good afternoon. Yes, was then. Apologies for the late start. We can still do some praise. Ultimate Health on Joy 99.7 FM with me, Nortey by nature. Glorious happy birthday to you, Madame Nelly Abbey of the Parliament of Ghana. I do believe today is your 50th. God's blessings, many more years to come. Let's take this from Felix Owusu. It's ready.
Joy 99.7. Joy 99. Joy 99.7. Joy 99.7.
Tell a friend, it's ready. It's called Ultimate Health.
Joy 90. Joy 99. Joy 99. Joy 99.7 FM. Joy 99.7 FM. Joy 99.7 FM. Joy 99.7 FM. Joy 99.7 FM.
That's right. That's how I usher you into Ultimate Health on Joy 99.7 FM. 16th of February. Felix Owusu there. All right, let's whiz into serious stuff, huh? And as you may be aware, Ghana is experiencing cholera, let me get it right, outbreak, but I've been, zipping back and forth between outbreak and, of course, epidemic. I've got the head of our EPI, the program manager for our EPI, Dr. Kwame Amponsachiano. Anytime he comes in here, there's serious business to talk about. He's been manning this station, if I can call it that, the EPI, for several years. He's also head of Disease Prevention and Control Department of the Ghana Health Service, and he heads our expanded immunization program. Doc, you're most welcome.
Thank you, Nortey.
You've already informed me that you have a raspy voice.
Yes.
When the chap in charge of our EPI is not feeling well, we need to be worried. If you catch a cold, then what about the rest of us?
But I don't think this is a cold.
It's not a cold. Okay.
No, it's just some husky voice.
Okay.
Need to
All right. Not due to Valentine.
No. It has nothing to do with Valentine.
All right. Great to have you as always. We've been experiencing, again, you will correct me, but it also educates our listeners, an outbreak of cholera. My reading and the little information I picked out suggests that it may have or probably did start somewhere late last year in Adan East, I believe, and then it seems to have spread. Now, my understanding is that if we have quite an upsurge of cases, then we are dealing with an outbreak. But currently, it seems to have spread across, I think Greater Accra, Central, Eastern, Ashanti, and parts of Western region. Am I right, Doc?
Well, that is right, but let me first greet your cherished listeners.
Right.
Right.
You see,
Good afternoon.
We've cured your voice already.
Thank you very much. Yeah, so that is right. But it's difficult to say it spread from Adan East to the rest of the areas you mentioned. First of all, we've recorded cases in all the areas.
In these regions, right?
Yes, that's correct. But as for the spread, we cannot be sure.
Okay.
Suffice to say that yes, as a health service, we first detected cholera in Adan East.
Okay.
But it's very difficult to trace the spread and say the rest were due to Adan East.
Right.
Because we actually have it in many of the coastal areas, as it were. So they could be independent cases.
Okay. So the sentence was just to show where it's gotten to now.
Okay, so
not to say
I get it.
I get it.
Yeah, that's correct.
Okay.
So, and to say whether it's an outbreak or epidemic, for us as epidemiologists, they are used interchangeably.
Okay.
We know some people try to, differentiate the two, but essentially it's the same.
Essentially it's the same. All right. My listeners are well advised. Right. But this tends to be, from the pattern, in the southern areas of the country. I've done, in fact, this month, Ultimate Health should be, are we 22? 22 years, but I do recall between 2010, 2014 was pretty bad.
Yep.
Very, very bad.
Yes, you are right.
Okay.
You are right. That's when we had the largest number of cases ever.
Okay.
Since 1970.
Great. Now, we do get information, and folks, if you've just joined us, we're going to be looking at the current update. So, a situational report, and then we'll look at the measures that have been taken, one of which is an ongoing vaccination program in 3 districts, I believe, of Greater Accra. Right? We've had some earlier ones. Doc will give us that. But let's start to understand this. So we see and we hear reported suspected cases and then confirmed cases. Right.
Sure.
So I'm happy we have you in the seat to confirm.
Right.
Right? When we say suspected cases, then they've been reported as suspected cholera.
Right.
Okay. And then confirmed means what exactly?
Right. So maybe I have to go back to the basic principles. As a health service, we monitor the pulse of the nation. Okay. So we try to, put surveillance on diseases that have the tendency to cause epidemics or outbreaks, so to speak.
Right.
And cholera is one of them because one case of cholera can generate several cases, as you put it in at first. Right. So what we do, because cholera, the major symptom of cholera is diarrhea. Okay. We put surveillance on diarrhea. Generally. So yes, generally. Okay. So whether we have cholera or not, we still putting surveillance on diarrhea, and then we test. So when you test for the germ and it is positive, usually in the lab, then we say you have confirmed cholera. Right. Once you confirm cholera, because it can be explosive, you need to widen the net, because one case technically is an outbreak. Right. Because you need to act. Okay. That is why we classify just one case as
so this surveillance is critical. And it's not because you've had an outbreak or you've had a suspected case.
Not at all.
It's a routine thing done by the health service.
Excellent. Right. It's a routine thing we do outside outbreaks.
Okay.
And that is the only point you can even tell that you have a problem.
Okay.
And so when we do that, when we test and we get positive, we widen the net. And so anything that is that resembles diarrhea,
Okay.
we pick it.
Right.
You want to err on the side of safety.
Okay.
And that is when we say we have a suspected case. Until we prove it,
All right.
we will treat you as cholera.
Okay.
Because it's cholera that is going to kill you.
Okay.
And so that is the difference between the suspected and the confirmed.
Okay.
But again, because of logistics, if you confirm 1, 2, 3, you don't need to be confirming every case.
Right.
Because of course, then it means you are wasting, in quotes, the resources.
Right.
So you just,
You roll out.
yes,
a
I mean,
response.
just cast a very wide net.
Okay.
And put people who may not even have cholera,
Mm-hmm.
but have just diarrhea and vomiting as cholera.
Okay.
And then err on the side of safety and treat them.
Okay. Folks, if you've just joined us, it's 16 minutes past the hour of 2 on Joy 99.7 FM.
Joy 99.7 FM.
The program, as always, on a Sunday afternoon is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. I'm in the studio with the program manager for our expanded program on immunization, Dr. Kwame Amponsa Achiano. We're talking about Ghana's current cholera situation. There has been an outbreak, and there's several features of this outbreak we need you to understand so that you can be part of the response, right? So we've been talking about numbers, that which indicate suspected cases and those which are confirmed. Doc will give us, an idea of those numbers. Unfortunately, we have also recorded fatalities, deaths, all right? And we know that the progression of this disease, especially untreated, is pretty fast, okay? And it can, within a couple of days, and some people, in fact, some of my reading, Doc will confirm, suggest that a significant number of cases actually progress to fatality in under 24 hours. So we need to understand this. That's why we're sharing this. Our WhatsApp is 055 11 11 997. And shortly I will activate the phone lines. We're live on Facebook, YouTube, and X. And I will shortly activate the phone lines. All right. This is something you must know. Right. And of course, we'll get into what is going on in Greater Accra, where there's an ongoing vaccination process. It started on the 14th. Valentine's Day, and ends tomorrow in selected districts of Greater Accra. Doc will go through those, okay? Right, so Doc, coming back. So we've got numbers, we've got an understanding of what is suspected, what is confirmed. But let's talk a bit about the disease itself. It's a diarrheal disease. What kind of things will we see, and how do we get it, and its mode of transmission, without assuming that everybody listening to us understands or knows?
Right, so again, from basic principles, cholera is a disease of filth.
Okay.
It's basically. And
essentially that's an indictment.
Yeah, of course. Once you see, when I always say this, and I don't think people take kindly to it, but that's a fact.
Okay.
That if you get cholera, it means you've eaten feces, literally.
Literally.
That's what it means, unfortunately.
Mm-hmm. Go ahead.
Yeah, so it's caused by a germ known as Vibrio cholerae.
Okay.
Which is usually taken through the mouth.
Okay.
So it contaminates your food or water or your fruits. Of course, food and water. So anything that is food or water can be contaminated.
Okay.
And then you could also get it from somebody, directly from somebody who has cholera, may not even be showing the typical symptoms and signs.
Okay.
Okay. So just as you said.
In that sense, would that be oral as well?
Yes, it's orophycal.
All right.
So it passes through the feces and back into.
So you're in direct contact with somebody who has it.
Exactly.
And then still oral fecal.
Sure. And so indirectly, door handles.
Okay. You're touching
surfaces,
things the person has touched.
Exactly.
And then you go and touch food, water, and then
And then, or even you may not touch, but you touch your mouth.
All right.
And then that's it.
Okay. Understood.
Right. So once you get it, it will take about an average 2-3 days.
Right.
But it can be as short as a few hours, maybe 2-3 hours.
Before it shows
symptoms.
Okay.
As diarrhea, mostly.
All right.
But of course, you could also have vomiting.
Right.
So, and a combination of them. Incidentally, if you have 100 people contracting the germ, or let's say ingesting the germ,
right,
80 of them may not show anything at all.
Right.
But that is a dangerous proportion because they are the ones who will be shedding in the community. They are not sick.
Okay.
The so-called carriers. And the 20% or the 20 out of the 100 who will show symptoms, some of them may end up, in fact, if you don't treat them, about 50% of them will die.
Wow.
That is, if they don't treat at all,
Okay.
they will progress to severe disease
Right.
and die.
So this surveillance, this awareness that picks this up, is life-saving.
Very
even,
much so.
Even before we get to intervention or response, it's important that we know what's going on in our communities.
Exactly. That is the importance of surveillance. And it's
Right.
not just cholera. We do for other
Okay.
epidemic-prone
Right.
diseases.
I do know that currently there's an outbreak of
We
meningitis.
do meningitis.
Up north.
Yes,
Yeah,
that
and
is
so
true.
on. Okay, folks,
And
21
other
minutes
diseases.
past the hour of 2. I'm still speaking with Doc Kwame Amponsachiano of the expanded program on immunization. We're talking about the cholera situation, right? Currently, we have cases in Greater Accra, and that is not just Accra. Greater Accra goes further beyond, right? Greater Accra, Eastern, Central, Western, and some parts of Ashanti. Am I right?
Yes, Ashanti East. Yes, you've
Yeah.
mentioned Eastern. So
Yeah.
there are 5 regions
Okay.
that have,
I
that
wouldn't
have
typically,
recorded cases.
though I did say earlier, typically the southern coastal areas, Eastern Ashanti. So again, we're still dealing with a disease, a condition related directly to filth, sanitation.
That is very true.
Right.
And maybe going back again, the germ itself likes salt, salty water.
All right.
And so they thrive better in brackish waters like the lagoons and so on.
Okay.
And that is why almost always you find cholera along the coast.
Mm-hmm.
Of course, most of the ones that you would find in the hinterlands, like Eastern and Central Ashanti, would probably be an export.
Okay.
Yes.
All right. Folks, WhatsApp is active 055 1111 997. Shortly, I'll activate the phone lines, but not yet. We're live on Facebook, YouTube, and X. This is Ultimate Health on Joy 99.7 FM. We're talking about cholera. We wouldn't want to be talking about cholera in 2025. In my mind, just from the history and longevity of this program, I think that is a regression. We've gone backwards in some regard, and Doc is best placed to tell me, somebody on top of our surveillance and, of course, our interventions, should be able to look at this and see whether we've lost ground on this whole sanitation, defecation, water, and clean, potable, pipe-borne water and all those things. Have we regressed as a nation, and why are we seeing these things?
Nortey, you nailed it. It's a disease of filth.
Right.
And there are 3 things. It's about water, potable water. It's about sanitation.
Right.
And it's about personal hygiene. So these are the 3 things. Otherwise, health is just at the receiving end.
Right.
Because if we don't put these in place, and incidentally, we're in some of the areas, and as you know, sanitation is an eyesore.
Horrible.
So literally, people are eating their own feces, unfortunately.
Okay.
And I have to put it
Right.
blatantly.
Doc, we still have a lot to talk about, but let me move to so first of all, I want you to pin this down. We've mentioned the disease causing agent or the pathogen. Is it bacterial?
Yeah, it is.
It's a bacteria.
It's a bacterium
Okay. Right.
that causes cholera.
Okay.
And usually, as we said, would manifest as diarrhea and vomiting.
Okay.
Everything else is because of your diarrhea and vomiting.
Okay.
So sometimes you see people who would have had diarrhea and will have very dry mouth or lips. Even sometimes the mouth is dry. You may also find people who have sunken eyes.
Right.
I don't know whether you've seen that before. Yes.
Okay.
And then, of course, you also have people who will be complaining of muscle itches.
Right.
So these are because you are losing water and salt.
Mm-hmm.
I mean, salt is a constituent of the body.
Right.
And especially potassium. Once you lose that, all the issues around muscle contraction, heartbeat, and so on.
So
you
they might even have leg cramps.
Exactly,
And all those things.
leg cramps and all that. When it gets to that stage, they are almost going.
Okay.
Yes, it's the extreme form.
Right.
And people will normally, once they get a dehydration, they will start asking for water. They will drink
So
copiously.
thirst is also an
Exactly,
indication.
very, very, very
Right.
important. But those are the extremes.
Okay. Now, Doc, for folks listening to us, when they hear that we've recorded fatalities, firstly, let us know how many fatalities we've had, and then Who is this affecting? Is there a typical age bracket, or I know everybody is vulnerable, right? But is there a profile, a pattern that we can discern from the numbers and the data you have?
In fact, cholera affects everybody,
Right.
but especially those 2 years and above.
Okay.
But in Ghana, we are seeing some under twos, I mean between 1 and 2, who have also had cholera.
Okay.
But mostly 2 years and above, irrespective of sex.
Right.
And why it does not usually affect the under ones is because most of them will be breastfeeding.
Right.
And that is a protection in a
Okay.
way.
Right.
But
Okay.
even the under ones could still get cholera.
Okay. So the significant or critical factor that will facilitate all the damaging effects and ultimate fatality is the extreme dehydration.
That's it. That's the loss of water and salt.
and salt.
Yes.
Okay. Right. So that probably would be, should I say, a hint as to why we talk about rehydration and then the rehydration salts.
That is very true. You
Okay.
know, in cholera and in most diarrhea cases, we don't do anything much except to replace the fluids.
Okay.
You know, the body, the constituent of the body is about 66% water,
Okay.
and it's even more in children. And so once you lose water, you are on your way to the next world.
Okay.
And that is why it's so important that once you lose water, you start diarrhea and vomiting, you need to start something.
Okay. So
Water.
you're essentially giving advice to people who may be observing or experiencing these signs and symptoms.
Exactly.
They must rehydrate and they must report.
Exactly. So
Because
you start ORS or even home fluids, like you can even use coconut juice
Okay. Right.
or any other potable water available. If you have nothing at all, start drinking water. If you have nothing,
Just
you don't
plain
have
water.
clean water.
Clean
Yes.
water.
If you have nothing,
Do not go and reintroduce contaminated water.
exactly.
Clean
water, potable. Water.
Wash your hands. Don't use the same hands to handle sachet water, and then there you go.
Exactly.
Right. So you can rehydrate with normal water, but it
Potable
must be
water.
clean.
Potable.
Right. And then you should report.
That's it. You
Because-
find your way to the nearest health facility.
Okay. Sometimes I've eaten something, Doc. I had some takeaway from some bonyo party or funeral I went to and all that, and my stomach is a bit, when we say watery stool or diarrhea, is there anything distinct about it?
Well, it will be difficult for me to really distinguish between watery stool as it pertains to me or another person.
Right.
But when the constituency of your feces changes, you know.
Right. You know.
Yes.
Okay.
You know.
Right.
So it's big. Normally, we would for cholera would say watery stools, but you may not start with the watery stools from the beginning.
Right.
But loose stools.
Loose. Okay.
But then when you get watery stools, then obviously you know that it's something more serious.
Okay.
And therefore you need to do something about it immediately. In fact, for all loose stools, start rehydration.
Right.
Most diarrheas will stop. Most diarrheas will stop. But if you see that maybe after 2-3 bouts, it's becoming more watery, please. You need to find your way to the. Ordinarily, nobody. I mean, it'll be difficult to say that everybody gets diarrhea and they are moving to the facility. It doesn't practically happen.
Okay.
But then when you see that you are getting more loose stools, twice, thrice, and it's becoming more watery, start your. Even before then, you'd have started your rehydration.
Right.
Whilst you find your way to the next health facility.
Doc, can you help us with the kind of numbers we have now and a sense of whether this thing, if cautiously let me use that word, is slowing down? And then we'll go into the measures that have been taken and, of course, the vaccination. What kind of numbers are we having now? And is it telling us that we're getting a grip of this?
Okay. So you would recall that, as you rightly said, we started somewhere, recording cholera somewhere last year.
Right.
In fact, as early as August. That's when we had our first cases. But that outbreak fizzled out after all the interventions we put in place.
Okay.
Then they restarted somewhere in October.
Some related it to the elections and activities and movements.
Oh, this was October.
Yes, but I did see a rise,
October.
and some report I read was relating it to all the activity that, intermingling and all that. Is that possible?
Well, yes and no.
Okay.
You know, when you have gatherings, the chances that you would spread diseases is higher than when you don't have any form of gathering. So maybe, but it's just, we are only speculating. So, as I said, we had August, it fizzled out. Then October, we started recording cases.
Okay.
Again, Adan East started. Then it came to Adan West, back to Adan East. Then we recorded pockets in other areas in Greater Accra, including Gas South. Even along the line, we had 1 or 2 cases in Pung Katamanso. Then Kaswa came in, which is also Peri Accra. But you know Kaswa, that's a Wutu Senya is a central region. And so when the epicenter moved from Adan East, especially Adan East, Adan West Enclave, it went to Ga East and then to
East and Central.
And Central, of course, they are congruent districts. And then we had to intervene, just as we did. And so that's when we started the vaccination in Assam or Utu Senya East, which is in Central region. Then from there, you will recall that just around Christmas, we had many cases in Western region. Sekendi, Takrade, Ifia, Kosimintim, Shama, and Ahanta West. And then we had also recorded some cases in Eastern region. And again, because cholera is a fast, as it were, evolving disease, you get cholera, you get better within 2-3 days. And so, cumulatively, you know, including those who have recovered and all that, we would say that we've had over 6,000 suspected cases. And then for the confirmed, as at about a couple of days, we had confirmed about 600 plus. A number of people have lost their lives. Of course, for some, we wouldn't say it was definitely cholera. But if you have an outbreak and you have, let's say, anything, as I said, that resembles a diarrheal disease, you qualify it as, you classify it as cholera. And so among all that, we've lost about 40, unfortunately. 40 plus.
40 Ghanaians.
Yes, quite a number of them also dying even before getting to the hospital, unfortunately. Because they were waiting, diarrhea will stop, and then unfortunately.
So this is serious stuff, right? If we're talking about the beyond 6,000 suspected and then about 600 confirmed, that's about 10%.
Yeah, about 10%. And we keep on testing and
we're still testing. Okay. So we need to confirm the cases, but we also need to roll out a response. Okay, which we've been doing in there. I know you've done some of the vaccination in Central and Western.
Yes, so actually the response starts with the diagnosis.
The diagnosis, yes.
So once you declare you have an outbreak, you do the investigation. It's all part of the response. The social mobilization, communication, health education, they are all part of the response. Linking up with the assemblies to enforce the laws, to provide potable water is all part. The vaccine only comes to add to the arsenal, the tools that we have. Otherwise, I would say essentially, it's a water problem. It's a sanitation problem. So once we are able to solve that,
that's the root.
That is the root. We need to uproot it. Which we haven't done. Exactly. So, of course, if you have other tools that would prevent death, then obviously you need to also bring them in. That is why we are bringing in the vaccination, which we started in Utu Senya East in the Central region.
Doc, would I be right if I'm tempted to classify or target as seasonal, cyclical? Is it possible?
Well, it's a yes and no.
Are we destined, because I read some things about the sub-region, are we destined to have these cycles of cholera?
It's a yes and no, in the sense that normally you would expect cholera to fester during the rainy season. Where you have a lot of contamination going into the waters and so on.
The groundwater.
But this is a dry season. And so we can say it's seasonal in a way, but obviously you can have cholera all year round. And that is why one case is to us, when you see a case, you want to run
One case.
It's an outbreak. Yes.
It's an outbreak.
Yes. Because one case can generate thousands and if not millions of cases. Okay. Because one case contaminating, say, a very common source of water or exactly water. Right. can generate thousands and thousands of cases.
Let me give Doc a breather. I've got this from Dede, Maryland. She says the big one. Why can't we go back to Tankanse? Town council, where we had health inspectors going round, summoning, sanctioning, and making sure that you kept your environment clean. Yes. Tankanse is town council. All right. She's asking that, Doc.
Well, we in health, we have our mandate. This falls within the other, as it were, sectors.
Right. So that's local government.
Local government. Yeah. And I believe that if you heard a minister yesterday, we traveled to some of the affected areas, and he made it clear that he's going to work. Minister of Health is going to work with his counterpart in the local government ministry, because if you don't approve it, then obviously, as we say, health will always be at the receiving end.
But then that means they haven't been working.
An outbreak. Oh, I can't say that. If you look at the local level, well, right? I don't know. You are saying it, but
because we hear millions, spent on sanitation. Accra will become the best, the tidiest, the cleanest city in and we're back to cholera.
Well, at the local level, we know that counterparts in health are working with the environmental health people, but of course, everybody has their own challenge. And so they are the best placed people to tell you their challenges.
Okay. Right. 37 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. I'm in the company of Dr. Kwame Amponsa Achiano. He heads our expanded immunization program, the EPI. And we're looking at our current situation with regard to cholera. We didn't expect, we didn't envision that we'll be back to this kind of problem, but it does occur, and he's hit the nail right on the head. It's a disease of filth, sanitation, essentially, literally. You're eating feces that has contaminated your food sources, your water sources, and it leads to this diarrheal condition, which can progress very rapidly and can be fatal if untreated. We have recorded 40 plus fatalities across several regions and districts of this country. There have been various layers and levels of intervention, and as we speak, there is an oral cholera vaccination campaign ongoing in some selected districts of Greater Accra. Right, we'll talk about that. If you have any questions, concerns, 030-221-6541. 030-221-6541. WhatsApp is 055-11-11-997. Dede says in Maryland, we should go back to Tankanse. Good afternoon, Nortey by nature. I want to know the work of the assemblies in fighting this pandemic. Because, you've got into pandemic. Relax, calm down. Right? Because with people who are not doing the work they were mandated to. I remember in the 80s, a man called Salifu Amankwa at Circle in those days, who are you to throw anything about? He will discipline you, but today it's not like that. This is Gabriel Danso in Dawenya. Yes, we remember those days. Do we always want to go back to external, should I say, effort to make us do the right thing, right? But great point you got there. Hello, greetings, Mr. Nortey and Ultimate Health Team. Please, your resource person mentioned if someone contracted cholera, the person might have eaten someone's fecal matter. Please, is there a correlation between cholera and typhoid? Please, may I know if the vaccination is across the 16 regions or only the affected areas? Thank you. Concerned citizen Solomon sends that.
Bingo. They are related.
Bam.
It's very same.
Bam.
Typhoid means you've eaten somebody's feces.
I pick it.
That's it.
All right. So there's a relation.
Yes,
he's asking if I have, from the information I have, you're not doing this across the nation. He's asking, are you not going to do the 16 regions? Yeah.
No, we are not doing that.
Right. Are you saving
actually
data,
not really. What you need to do is to sink your resources to the most vulnerable.
Okay.
And so you need to make a case for individual districts. It's not even about the regions. It's about the districts. And that is why you recall I said we started
So this is an informed response.
Exactly.
Targeted.
We started from Ewutu Senya East.
Right.
Then we went to Efia Kwesimin team alongside Sekendi Takoradi, Hunter West, some 2 sub-districts, and then also Shama, about 2 or 3 sub-districts there.
Right.
And then currently we are doing just 1 district in Accra.
Okay.
It's Accra Metro. Remember the
Accra
unit.
Metro.
The unit of operation is the district. It's Accra Metro.
It's Metro.
It has 3 sub-metros.
Yeah.
Ashedu Keteke, Okankwe, and Ablikuma.
Right.
So those are the places we are doing.
So you are not even doing the whole of Accra Metro, right?
And then from here we'll move to back to Central.
Okay.
As Efutu and Agona West.
Okay.
Where we still have cases.
Right. Ziggy, do I still have a call on the line? All right. So sorry to the caller. Hello.
Hello, Nortey. Good afternoon.
Good afternoon. This is Oti.
Yeah.
All right. Share with us, please.
Yeah, afternoon, doctor. There's time to see about the cholera because sometimes somebody, it's not eating for a long time or something like they are not taking any tablets, so go and eat something like pepper food or something like that. The person started running. Would you say that is the cholera, or if the person run like 4 or 5 times, you just spread as a cholera, or you have it hit you one day, second day, third day.
Okay.
How will you face it? Because somebody, one person not taking any drugs and something.
Okay.
Like you eat for 5 months or something, but you get to eat some pepper food, and it started running.
All right. Okay. Understood. So he's asking if you get stomach upset due to something you've eaten, and he's asking how long should this be, and would you need to be concerned if it's related to something like that?
It's a very difficult question to respond to, but I would say that you don't have to in your head diagnose cholera.
Okay.
You don't need to do that because it could just be one stool,
right?
And you have it. You recall that I said if you have 10 people who have contracted the germ,
okay,
8 of them nothing shows, but they are still passing the stool. I mean the germ in the stools.
Right.
In other words, 80% of people will not show any symptoms.
Okay.
Most of them would also, those who show symptoms may also show very mild symptoms. You don't need to say I had 2, 3, 4, 5 before you diagnose as, you are diagnosed as having cholera.
All right. Okay.
Once you have diarrhea, you could have had cholera.
Okay. So be cautious and follow up with the tips that we've talked about. 030-221-6541. The phone line is still active. WhatsApp is 055-11-11-997. Good afternoon, Nortey by nature. Good topic today too. Can you please send me the type of tea bag that is not good for consumption? You mentioned that in last week's discussion. Oh yeah, that's a research that is talking about certain tea bags made of certain products, and that they may leak certain things into your... I'll look for it and see if we can share that, okay? Z from Akwete Man. Most tea bags do not have some of these constituents. All right. So WhatsApp is 055-11-11-997. Doc, when we say vaccination, I know it's part of a layered response.
Yep.
But essentially, you want to produce immunity, okay? The process is immunization.
Yep.
Right, but you are giving a vaccine, right? In the context of an outbreak, what are we expecting a vaccine to do, right? Okay. Can we explain this to the people, and then of course the type of vaccine, its safety, and then the mode of administration as the teams are already on the ground? Okay.
So when you have an outbreak and you have more vulnerable people,
right,
then the outbreak will fester.
Okay.
So what you want to do is to reduce the numbers that are as vulnerable as much as possible.
So you are protecting those
who are vulnerable.
Right.
And so beyond a certain point, even if not 100%, not everybody receives the vaccine. If a lot of people receive the vaccine, even those who don't become protected.
Right.
So in other words, you are shielding people.
So this is the same herd immunity
exactly
we were hearing
very, very, very much
during COVID.
Exactly.
So you want to
give a lot of people immunity within a short time.
Right.
So that even those who are very vulnerable and who cannot even take the vaccine will then also be protected.
and now it's an oral vaccine.
Yes, it is.
Now, I remember as a kid, I fought like Goliath because they had the gun in Kolebu, and you join a long queue, and it's like a staple machine. Braka, braka, braka. Oh my God!
That was smallpox.
Smallpox.
Yes,
yeah,
that was
yeah,
smallpox,
yeah,
yeah.
Right. And I fought and fought and
I
fought.
took it myself.
Please.
I think it was in the 75, 76 thereabouts. And they used to call it CD.
Hey, jai, 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 jai. So this is
remember.
an oral drop
Yes.
put in your mouth.
Yes.
Right.
And if vaccination has evolved. I always say that actually vaccination started from Africa.
Right.
I don't know whether you know
Yeah,
about
we
that.
talk-
We
yeah,
spoke about
we
it
spoke about
sometime.
that.
And at the time
Last
we're
year.
using
The scarification.
yes. Very similar to
What we see
you are
as
describing
tribal
now.
marks is really a cut, and then they put some.
Exactly.
Right.
Yeah. So now we have very different modes and very simplified methods, including the oral vaccines. Some we are even moving to the patches where you just get a patch.
Transdermal patch.
Yes, on your shoulder or
Right.
elsewhere, and then you move on.
Okey-dokey.
Here, the cholera vaccine is oral.
Okay.
Very simple to administer.
Okay. Dede in Maryland laments again. She wanted us to go back to tongue cancer. She said, unfortunately, it seems it's the Salifu Amankwa language we understand. Constantly being lashed to be in line. We love filth. Why should that be? So is it that the district, I used to do a lot of programs. I'll go back to some of them. They just don't apply the sanctions.
Well, it's a combination of factors. In terms of health promotion, you would want to first build the healthy policies, the laws.
So inform them.
Yes, the laws must be there.
Okay.
Then, apart from the laws, you want to create the enabling environment. So that people don't have toilets, provide the toilets or let them provide toilets.
Okay.
Then it's about building the person's skill to be able to change their behavior. So developing their personal skills. And then, of course, the other things that go with it. So it's a combination. It's not just about formulating the laws. It's also about giving the people the enabling environment.
Right. I got this one from Sonny.
And then some people just don't understand why they have to change their behavior. So it's a constantly, engaging people, letting them know the consequences.
All right.
So it's a bag of it's a mixed bag of things.
I'm gonna line up for a job with the I don't want to be linked to any government, but this is behavioral. We can deal with it with clear consequences. Sonny in Westland says, Nortey, if it's about football, all radio stations will hook up to GBC for broadcast, which in any way we won't win any medals, even wooden medals. Why not this important health issue? Sonny feels that he's not hearing enough about this.
Well, I shudder to.
Are you constrained when it comes to educating the public and the populace on these things?
No, we do that a lot. Nortey, how long have I been on your program? I think it's about a decade.
Yeah.
Okay, maybe we could do more, but remember again, it's some of these things only add to what is existing.
All right.
The actual work is done by the districts, so they engage the communities, the community health nurses, the disease control officers, the other people, nurses and all that. They go into the communities and they do that work. Okay. For us, we only complement that.
Okay, very well. Doc, so we understand there's been a couple of targeted vaccination campaigns. There's one ongoing, started on Valentine's Day, ends on Monday. Yes. You are targeting a certain degree or level of immunity or protection. Many would ask, this is about 3 days or so, is that sufficient, adequate?
Yes, so usually, as I said, you want to do that, give immunity to people within a very short time.
Okay.
So campaigns are usually done within a period of 4, maximum 7 days.
Right.
But for this particular one, we are doing 3-4 days.
Okay.
We started on the 14th. That was the Friday. We are ending tomorrow.
Okay.
We are looking at about 300,000 people, a little less than that.
In this sub-metro?
In the 3 sub-metros of Accra Metro.
Okay.
So we are targeting children 1 year. Okay. Anybody 1 year and above.
1 year
children
and
above. I mean children and adults. 1 year and above.
Okay. A friend of mine will say the whole. Attempt all questions. Ablekuma South, Okankwe South, Ashiedu Keteke.
Yes.
Right.
Okay.
These selected places, or are they? What are they? These
are sub-metros. You know, the target is the district. That is the metro.
Okay.
Which is one district out of the 29.
So since you're targeting these, just for the education of my listeners, what does that mean? It means that the numbers there are worrying.
Exactly. So you look at the mix of risks there, and then you make a case. You know, the cholera vaccines actually are housed by what we call the International Coordinating Group.
Okay. And
incidentally, maybe just to give this information, we have about 20 countries in Africa that are currently battling or have battled cholera in the recent past.
Okay.
We go on to the same market. And it's not just even restricted to Africa. Every country has the opportunity to also go to that same market.
Right.
Which is supported by Gavi, the Vaccine Alliance.
Right, yeah.
So they've stockpiled some vaccines for us, and you need to make a case for it.
Right.
So the case is usually made on district by district basis.
Okay.
And that is the reason we are able to make a case for Accra Metro.
Right.
Because they've recorded some cases in the past. And looking at the mixture of, they have some semblance of rural, urban, even though they are urbanized. You are also looking at the slum areas and all that. So once you're able to make it the case, you get the vaccines and you deploy.
Okay.
So we did make a case. We were successful. We have had the vaccines and we are deploying.
Okay.
And it is because they had recorded some cases.
Doc, I have to take a brief commercial break. When I come back, I'll ask you the response. Since you've done Central, you've done some Western, and you've come back to Greater Accra, the response to the vaccines and then the way forward.
Right.
Okay, we do know that we have a root problem we have not properly addressed. Take and stay.
Wear a condom for sex and protect yourself from HIV. HIV has no cure, no condom, no sex. This message is brought to you by the Ghana AIDS Commission.
Okay, welcome back. That was a short commercial. It looked longer than that. Maybe it was abruptly ended, but that's something from the Ghana AIDS Commission. I see they've upped the ante a bit, but we're still talking about cholera in the studio with Dr. Kwame Amponsa Achiano of the expanded immunization program. Doc, what's been the response? There's been a lot of back and forth on, we do this every time we bring you in on vaccines, but generally, what's the response of the public to the teams? What do the teams look like? And what if my area or locality is not included in the sub-metros?
So let me respond to the first one. The response has been great.
Right.
Right from Central through Western. Normally, response to vaccines also largely depends on risk perception.
Okay.
People have seen people die from cholera, and so they are actually rushing for the vaccine.
Right.
I would say that in Greater Accra, we are using just as we did in Awutu Senya East, we are using a combination of healthcare workers and volunteers. When you want to vaccinate a lot of people, you need a lot of manpower.
Right.
So we normally work with volunteers who we train to also administer or support in the administration, either by recording on the cards or something. So we are doing that. We also use volunteers to do the canvassing in the houses,
right,
to pre-inform them that we will be coming there. So we are doing house to house. We are doing the lorry parks and markets.
Okay.
We are doing schools,
right,
as well. Anywhere you have gatherings. Even today, many of them were in the churches and are still in the churches.
Okay.
Doing the vaccination.
So a team might come to your church.
Yes.
And what?
In those three sub-districts,
those
sub-metros.
Yes. Is it compulsory? What do they look like? Do they have tags? And will they ask my permission?
Well, for us, once you see somebody with that bag, that unique bag, the so-called vaccine carrier,
right?
We don't just supply them anyhow. So, some of them may be in t-shirts, but not everybody has the opportunity of wearing a t-shirt.
Right. So they're going around,
and most of them too are local health workers who are known. Within those, they work with them already.
Okay.
So,
and what if I've had it already? Can I?
I doubt whether anybody has had cholera vaccine, because the very first vaccine was introduced in November, late November.
Okay.
But if you have had it and it's 2 weeks, technically you need two doses.
Right.
To be fully protected.
Okay.
But within an outbreak setting, one dose is enough for protection for a minimum of 6 months.
Right.
By which time the outbreak will hopefully be over.
Right. I think I did ask a question. I can't recall the response. Maybe let me ask it again. So are we making impact? Are we getting this under control of sorts?
Yes, in a way, because if you look at where we did the vaccination, for example, cases have been brought down to the barest minimum. In fact, in Assam, for example, in Tusenya East, it was really, I don't know whether you follow the media for some time, it was really the epicenter. Now, we don't have any cases. Even if we have, it's just 1 or 2 suspected
the new DG
cases.
is also going around.
Correct. And then in Western region, just before Christmas, it was going to be a big bang if we hadn't intervened.
Right.
You know, they have this festival of masquerading.
Yeah, the masqueraders.
Now we were able to do the vaccination before that. Otherwise, it was going to be explosive.
Wow.
Now they are recording very few cases. So it's really, I would say it's under control, except for the new areas like Efutu and then Swedro area, which is Aguna West.
Okay.
Where we hope to intervene from next week.
Okay, right. Not to just look at our water bodies and you can see what we are doing to ourselves as a nation. I think we should start punishing people to stop this. Gabriel K. Danso in Dawinya again. Right, Gabriel, I'm going to go for that job. Minister at large for behavioral modification, just to deal with some of these things. But you're quite right, spot on. Hope no impersonation. What did they say here? Hope no impersonation. I'm not getting who's impersonating who. Oh, you mean the people going round? She's asking, is it possible that people could infiltrate the ranks and claim they are going around administering something which is not the vaccine?
Well, as I said, the healthcare workers are people who are known within those communities already.
Okay.
It will be difficult for anybody to impersonate healthcare because they know them. And as I said again, the healthcare workers work with the community volunteers who have been their partners over time, and they know themselves.
Okay.
And once you see a community volunteer, who already is working with your community, I don't think there's any cause for alarm.
Nana on the Spintex Road says, "Good afternoon, Nortey. This cholera outbreak is due to serious water crisis in the country. The Galamsey menace is a contributory factor. Ghanaian politicians are interested in votes rather than doing the right things. Sad country we live in." Nana on the Spintex Road. So water is
water, sanitation. Water and sanitation.
Right. Okay. All my listeners are saying the right things. All of a sudden, my stomach is feeling a bit. Is it a discussion? But Doc, so we've done this. We still have to do the education. There still needs to be that interface between the Ministry of Health, Ghana Health Service, the local government structures. Right. The districts have to get on board.
Yes.
Right.
The community water people, the water and water company, and everybody. I mean, it's a shared responsibility, and of course, the individuals themselves also have roles to play.
I was scanning through the data. I try to do that when I have a program or a topic I've done before. I was trying to look for a year where we had 00000.
Yes, I can give you that information.
Yeah, there was a period where.
So, the first case of cholera in Ghana was actually in 1970. It started around the Nyenyano area.
Yeah.
And then the following year, that was 71. There was actually a pandemic, as we came to learn. Since then, we've been having some cholera, recording some cases. But in particular, in the past, I should say between 2008 up to about 2015, especially in 2014, where we had more than 20,000 suspected cases with quite a number of them confirmed. And arguably, that was the peak of it.
Right.
During the COVID time, you remember, we didn't record cholera cases.
Right.
Why? Because there was this enforcement of the hand washing facilities and hand hygiene.
We learned it, but
So that 3-year
strongly-
period,
right?
we didn't.
Okay,
And then we all went to sleep, and suddenly cholera has come back.
right.
So as I said, it's more about water and sanitation.
Water
If you're able-
sanitation.
if you're able to maintain a personal hygiene, of course, environmental hygiene and sanitation, we get water.
Right.
Cholera should be a thing of the past.
Okay. Doc, I know these pieces of data, these outbreaks, and our responses and our capacity to deal with these things are of global significance. Does a cholera outbreak, should I say, is it a significant index or indicator for a country developmentally?
Definitely. In
Right.
fact, all diarrheal diseases are indices for
Right.
for
So
development.
if you have a country, globally that is known to have these outbreaks, then it's not a good measure of their level of development
Definitely
and the
not.
quality of life of their people.
Definitely not.
Right. So folks, I'll end on that note. We are all indicted, right? Not just those who should respond.
Sure.
We are all indicted. You throw things around.
Yeah.
Sometimes I see posh cars.
Before you go,
Yeah.
on, maybe I should talk about open defecation.
Right. Please do.
It's massive.
If we can do that in about
Yes,
a minute.
yes, and it's something that I think we should all put our shoulders to the wheel and make it a thing of the past.
Right.
People defecate in polythenes and
Free
throw
range.
them about. And when we talk of open defecation, it's not going to squat
It's not just going to
on the
people
quarter or something.
doing it,
Exactly.
downloading
People
in
do it.
in a bag, in
That's
a
the
bucket,
point.
and then going to dump it in a drain
And the,
or by the
and the children
roadside.
will be playing with these polythenes.
Dogs
and
will go carry it back and forth. Right, we need to. I heard the new health minister was I forgot his Minta Akando.
Honorable
Honorable
Minta
Minta
Akando.
Akando, right, talking about these things, and then somebody also tagged on and said something about those building houses should not be allowed to build houses that don't have toilets.
That's
Right?
That would be
We
right.
got things to do. I've seen that looking at the data, even in the years that we had very low numbers, some of them surprisingly had high case fatality. I've got a graph here that I've been looking at, but we don't want any fatalities. Doc has said one case is an outbreak.
Yes.
And because of its potential to, should I say,
To spread
to
further
spread
and be
exponentially.
explosive.
Right. Doc, we're thankful and thumbs up to you and your team for the response. And we hope that we get this under control. And we probably will have to bring in the local government structure to look at what we're doing about sanitation, bylaws, and the sanctions contained in our laws. Thank you so much.
Thank you very much for having me.
Yes, he's my Absu brother.
Yes.
Me and Moba, but
You,
he's my,
you don't want to start a fight.
no, because we always win. But he's
Of
my
course.
Absu brother, and they're right on the on the beach. Ironic, right? Many thanks, Dr. Kwame Amponsa Achiano, head of the or program manager of the expanded program on immunization. We've been talking about cholera. It's a serious thing. You should all take it seriously. Sadly, we've lost 40 plus Ghanaians. We're hoping that will end and we can actually bring this under control. The vaccination is ongoing in those 3 sub-metros, and make sure if you are in those areas, you get covered. Stick and stay on Joy 99.7 FM. Ziggy Bedu is coming up with, I think he's still in the love mood. So I'll play this one and then he'll take over. You people wait for February before you fall in love and fall out of love and get broken hearts. But many of you had a great time. So take this one from Chris DeBerg, Lady in Red. Stick and stay. My name is Nortey. I'm out.